Most people think strokes announce themselves. Numbness, slurred speech, a dramatic collapse. And for some, that's true. But after 60, the most dangerous strokes don't wait for morning. They happen in the dark, while you sleep, while your body thinks it's healing. I've seen it more times than I can count. A 68-year-old retired teacher who walked 5 miles every single day. Perfect cholesterol numbers. Took her medication exactly as prescribed. Her husband found her at 4 a.m., half her face frozen, unable to speak. The damage was already done. Here's what nobody told her, what nobody tells most people. What I'm going to tell you today. My name is Dr. Michael Hartwell. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,300 chests. I've held beating hearts in my hands. And I've spent nearly 3 decades watching the same preventable patterns repeat. Patients who did everything right and still ended up on my table. Or worse, didn't make it to my table at all. Today I'm going to tell you what nobody took the time to explain to them. The 5 things happening in your body overnight that are setting the stage for a stroke and what you can do about them. Starting tonight. Your body after 60 is not the same body you had at 40. That's not metaphor, that's biology. Let me give you an image that makes this clear. Think of your cardiovascular system like a garden hose that's been running for 6 decades. When it was new, it was flexible. It could handle pressure surges. It bounced back. Now, the rubber has hardened. The inner lining has deposits. And when you turn the pressure up suddenly, something gives. After 60, your arteries lose elasticity at an accelerating rate. Your blood vessels can't cushion pressure spikes the way they used to. More than 60% of all strokes in people over 65 happen during sleep or within an hour of waking. The medical term is nocturnal cerebrovascular event. The reality is simpler and more terrifying. Your body's margin for error shrinks to almost nothing while you're unconscious. And the things you do in the hours before bed, the things you assume are harmless, are pushing you past that margin every single night. Now, this first one surprises people every time I bring it up. It has to do with when you eat dinner. Most people finish eating somewhere between 7 and 9 p.m. Then they sit on the couch, watch some television, maybe have a small snack, and they go to bed a couple hours later feeling perfectly fine. Here's what's actually happening inside your body during that time. When you eat a meal, especially one that contains carbohydrates or anything processed, your blood sugar spikes. That spike triggers insulin. Insulin pulls sugar out of your bloodstream and into your cells. So far, so normal. But after 60, that process becomes less efficient. Your cells become more insulin resistant, which means your pancreas has to pump out more insulin to get the same job done. And here's the problem nobody explains. Elevated insulin at night does something dangerous. It tells your kidneys to hold on to sodium. Sodium pulls water into your bloodstream. That increases blood volume. Blood volume drives up blood pressure. And blood pressure during sleep, in an aging cardiovascular system with stiff arteries, creates the exact conditions for a clot to break loose or a vessel to rupture. Think about what else is happening when you eat late. Your digestive system is working hard. That requires blood flow. Blood gets diverted to your stomach and intestines, away from other organs. Your heart rate increases slightly. Your body temperature rises as it processes food. All of this is metabolic activity that should be winding down as you prepare for sleep, not ramping up. And when you finally do lie down with all that's still happening inside you, your body is stuck between 2 competing programs. One program says rest and repair. The other program says digest and process. The conflict between those 2 signals creates internal stress. Stress hormones like cortisol stay elevated. Cortisol keeps blood pressure up. It's a vicious cycle that plays out every single night in millions of bedrooms. I had a patient 2 years ago. I'll call him Robert, 71 years old, retired postal worker. His routine was dinner at 7:30 p.m., always a good-sized meal because that's when the family gathered. Pasta, bread, dessert sometimes, nothing extreme. He'd go to bed around 11. Blood pressure during the day was well controlled on medication. But nobody ever checked what his blood pressure was doing at 2 a.m. When he had his stroke, it was 3:40 in the morning. The neurologist who treated him later told me his blood pressure in the ER was 210/115. It had spiked while he slept. The insulin from that late, carbohydrate-heavy dinner had set the whole cascade in motion. Here's what you need to do. If you're eating dinner after 7 p.m. and going to bed before midnight, you're compressing the window too much. The fix here costs nothing. Eat your largest meal before 6 p.m. If that's not possible because of your schedule, then make your evening meal the smallest and lightest of the day. Protein and vegetables, minimal starch, no heavy carbohydrates after 5 p.m. Give your body a full 5 to 6 hours to process that food before you lie down. That question has stayed with me. How many strokes could we prevent if people just knew to shift their dinner hour earlier? Let me ask you something before we go further. Do you take a hot shower or bath before bed? A lot of people do. It feels relaxing. It's part of the wind-down routine. Doctors even recommend it sometimes for better sleep. And for younger people, it's generally fine. For people over 60, it's playing with fire. Here's the mechanism. When you immerse your body in hot water or stand under a hot shower for more than a few minutes, your blood vessels dilate. They expand. Blood pools in your extremities. Your heart has to work harder to move that blood back up to your brain. When you step out of that hot water, your body tries to re-regulate. Blood vessels constrict rapidly. Blood pressure spikes. And if you do this late at night, then lie down shortly afterward, you've just created a massive pressure swing in your brain circulation during the exact hours when your stroke risk is already elevated. The sudden temperature change is the trigger. Hot water makes your skin vessels open wide. Your core body temperature rises. When you step out into cooler air, your body panics slightly. It tries to preserve core heat. Blood vessels in your skin slam shut. That redirection of blood from the periphery back to your core happens fast. Too fast for aging vessels to handle smoothly. It's like going from a wide-open highway to a narrow tunnel in seconds. The pressure wave that creates can be enough to dislodge a vulnerable plaque in a carotid artery, or cause a small vessel in your brain to rupture if it's already weakened. And you feel none of this happening. You just feel relaxed and ready for bed. This isn't theoretical. I've held the hearts of people who had this exact sequence of events in their final hours. Hot evening bath, sudden pressure change, stroke during sleep. The families had no idea. They thought they were doing something healthy. One patient, a 66-year-old woman who loved her nightly baths, had been doing it for years without incident, until the night her body couldn't compensate anymore. She survived, but she lost function in her left arm permanently. She told me later, through tears, that if someone had just explained this to her, she would have switched to lukewarm showers in a heartbeat. That question has stayed with me. The specific fix here is simple, but requires you to change a habit that probably feels good. If you shower or bathe at night, keep the water warm, not hot. You should be able to hold your hand under the stream comfortably for 30 seconds. That's warm. If you pull your hand back instinctively, it's too hot. And give yourself at least 90 minutes between stepping out of the water and lying down. Let your cardiovascular system stabilize. If you love the ritual of hot water before bed, move it to the morning. Morning showers after 60 carry far less risk because your body is already in its active phase. 2 more items after this one. And item 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. This next one is the hardest to talk about because it involves medication that millions of seniors take every single night. Sleep aids. I'm talking about over-the-counter diphenhydramine products. The ingredient in Benadryl, in Tylenol PM, in Unisom. Maybe you take one occasionally when you can't fall asleep. Maybe you take one every night. It's sold without a prescription, so it feels safe. It is not safe for people over 60, not even close. Here's what diphenhydramine does that nobody tells you. It's an anticholinergic drug. That means it blocks acetylcholine, a neurotransmitter that your brain uses for memory, attention, and critical functions like regulating heart rate. In younger people, the body compensates. In older people, especially those over 65, that compensation system is weaker. Anticholinergic drugs have been directly linked to increased stroke risk, increased dementia risk, and something called orthostatic hypotension, which is a sudden drop in blood pressure when you stand up. That drop can cause dizziness, falls, and in some cases, a transient ischemic attack, a mini stroke. But here's the part that makes this even more dangerous at night. Diphenhydramine suppresses REM sleep. It might help you fall asleep faster, but it prevents your brain from cycling through the deep restorative sleep phases it needs. And during those disrupted sleep cycles, your blood pressure regulation gets worse. REM sleep is when your body does critical cardiovascular maintenance. It's when your blood vessels relax, when inflammatory markers get cleared, when your nervous system recalibrates. If you're chemically blocking that process every single night, you're essentially preventing your cardiovascular system from doing the overnight repair work it desperately needs. You're trading short-term unconsciousness for long-term vascular damage. The research on this is clear, but rarely discussed in mainstream medicine. A 2015 study published in JAMA Internal Medicine tracked over 3,000 adults aged 65 and older for more than 7 years. Those who used anticholinergic medications regularly, including diphenhydramine, had a 54% higher risk of developing dementia. Another study from the University of Washington found similar elevated stroke risk. The mechanism is cumulative exposure. Every dose adds up. I didn't fully understand this until about 12 years into my practice. I had been telling patients, sure, take a Benadryl if you need to sleep. It seemed harmless. It was over the counter. Then I started seeing the research, and I started counting how many of my older patients who ended up with strokes had been using diphenhydramine regularly in the months before their event. The overlap was impossible to ignore. Write that down. If you're over 60 and you're using any sleep aid that contains diphenhydramine, stop tonight, not next week, tonight. If you need help sleeping, talk to your doctor about melatonin at a low dose, 1 to 3 milligrams, or magnesium glycinate, 200 to 400 milligrams before bed. Both are far safer and actually support your natural sleep architecture instead of disrupting it. Here's where it gets complicated. And this is where I need you to hear me clearly, because this is where the most preventable damage happens. Your blood pressure at night should be lower than your blood pressure during the day. That's normal. That's healthy. It's called nocturnal dipping. In a well-functioning cardiovascular system, blood pressure drops by 10 to 20% while you sleep. That gives your heart and your blood vessels a chance to recover from the stress of the day. But in many people over 60, that dipping doesn't happen anymore. Their blood pressure stays elevated all night. Or worse, it rises. This is called non-dipping, and it dramatically increases stroke risk. More than doubles it, according to some studies. The problem is, almost nobody knows whether they're a dipper or a non-dipper. Your doctor checks your blood pressure in the office at 10 a.m. Maybe you check it at home once in a while during the day. But what's it doing at 2 a.m.? At 4 a.m.? You have no idea. And neither does your doctor unless they specifically order a 24-hour ambulatory blood pressure monitor. Most don't. It's not part of the standard protocol. So you go through life thinking your blood pressure is controlled, when in reality, it's spiking dangerously every single night while you sleep. That hidden surge is eroding your blood vessels. It's creating microlesions in your brain's small arteries, and eventually, one of those vessels gives out. Stroke. Let me tell you about a patient. I'll call him David, 69 years old, former high school principal. His daytime blood pressure was perfect, 118/76 on medication. He felt great. No symptoms, no warning signs. Then one night, he woke up at 5 a.m. unable to move his right side. The stroke had happened sometime between 2 and 4 a.m. When we finally did a 24-hour monitor on him weeks later, during his recovery, we saw the pattern. His blood pressure at night was routinely hitting 160/95, sometimes higher. He had been a non-dipper for years and never knew it. Here's the specific action you need to take. If you are over 60 and you have any history of high blood pressure, even if it's controlled with medication, ask your doctor to order a 24-hour ambulatory blood pressure monitor. Write that down. The exact question to ask is, can we do a 24-hour ambulatory monitor to check if I'm dipping normally at night? Most insurance covers it. The device is small, attaches to your arm, and takes readings automatically throughout the day and night. If you're not dipping, your doctor can adjust your medication timing. Often, taking your blood pressure medication at night instead of in the morning fixes the problem entirely. That one change could save your life. This last one is something I wish I had understood earlier in my career. It has to do with how you sleep. Not how long, how. Specifically, which side you sleep on. Most people have a preferred side. Maybe you sleep on your right side because it feels comfortable. Maybe you switch throughout the night. But here's what the research shows, and it's striking. Sleeping on your right side increases pressure on your heart and reduces the efficiency of blood flow back to the heart from your lower body. That creates a slight but measurable increase in cardiovascular strain overnight. For younger people, again, the body compensates. For people over 60 with any degree of arterial stiffness or heart valve issues, that strain adds up night after night. Your heart is positioned slightly left of center in your chest. When you lie on your right side, gravity pulls it toward the right, compressing it slightly against your rib cage. That compression is minimal, but over 8 hours, it adds resistance to every single heartbeat. On the other hand, sleeping on your left side allows your heart to pump more efficiently. It reduces the workload. It improves circulation to your brain. The aorta, your body's main artery, curves to the left. When you sleep on your left side, blood flows more naturally through that curve. Less turbulence, less strain. Multiple studies have shown that people who sleep predominantly on their left side have lower rates of nighttime blood pressure spikes and better overall cardiovascular outcomes. It's a small thing, but small things compound. I sleep on my left side. So does my wife, also a physician. We made that change about 10 years ago after I read the research. It cost us nothing. It required no medication. Just a conscious choice to retrain a habit. If you've been sleeping on your right side for decades, it's going to feel awkward at first. Use a body pillow to prop yourself in position. Give it 2 weeks. Your body will adapt. And every night after that, you're reducing strain on the organ that's been working for you without rest since before you were born. I want to be honest with you for a moment. Not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that should never have needed my hands on it. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. In case after case, the contributing factors were not mysterious. They were a late dinner, a hot shower, a sleeping pill, a failure to monitor blood pressure at night, a habit of sleeping on the wrong side. These are not exotic risk factors. They are the background noise of millions of ordinary evenings. The routine nobody questions. And that background noise, accumulated night after night, year after year, creates the conditions for a catastrophic event. The system doesn't warn you. The 8-minute appointment doesn't cover it. The standard blood pressure cuff at the pharmacy doesn't catch it. You're left to figure it out on your own, or not figure it out at all. I wish I could tell every family before it happens. I can't, but I can tell you. I want to tell you about a patient. I'll call her Diane. 73 years old, retired librarian. She loved her daily routines. She had a stroke at 2:30 a.m. on a Tuesday in March. It was a left hemisphere ischemic stroke. Significant damage. When she came to me months later for a cardiac workup, we went through her entire routine leading up to that night. Dinner at 8 p.m., hot bath at 10 p.m., diphenhydramine to help her sleep, blood pressure medication taken in the morning, not at night. She had been doing all of it for years. We changed everything. Dinner moved to 5:30 p.m., warm showers only, and earlier in the evening. Melatonin instead of diphenhydramine. Blood pressure medication moved to bedtime. Left side sleeping with a body pillow. 6 months later, she had gone from needing assistance with daily activities to hiking short trails with her grandchildren. Her blood pressure at night dropped from an average of 152/88 to 128/76. The first thing she said to me at her follow-up was, "Why didn't anyone tell me this before?" That question stays with me. It's a big part of why I make videos like this one. Let me summarize the 5 critical things we covered today. 1. Eating late, especially carbohydrate-heavy meals after 7 p.m., spikes insulin and blood pressure overnight. Move your largest meal earlier. 2. Hot showers or baths before bed create dangerous blood pressure swings in aging arteries. Keep water warm, not hot, and shower earlier. 3. Diphenhydramine and other anticholinergic sleep aids increase stroke risk and disrupt your natural sleep cycles. Switch to melatonin or magnesium. 4. Non-dipping blood pressure at night dramatically raises stroke risk, and most people have no idea if they're affected. Get a 24-hour monitor. 5. Sleeping on your right side increases cardiovascular strain. Train yourself to sleep on your left. Which of these habits do you recognize in your own evenings? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who needs exactly this information. Send it to them. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day since before you were born. It deserves the best information you can give it. Take care of your heart.